Thank you, thank you everybody for joining us tonight for maximizing Social Security work incentives. And hold on one second, I am having some technical difficulties. Okay. Okay, and we are going to be covering the work incentives tonight associated with Social Security disability insurance. And we primarily will be focusing on the financial aspects of those benefits. Myself and Kris Colcock, who is with us tonight, we are both certified work incentive practitioners, meaning that we have had training in benefits work as it relates to individuals receiving Social Security, disability, and other benefits. We will briefly touch on some Medicare work incentives that are related to working while you're receiving Social Security disability. So, Kris, thanks for coming back, and thank you to our participants for joining us. Why don't you begin, Kris, by telling us how an individual, or I should say, why an individual may be receiving Social Security disability benefits?
So wonderful. I'm very happy to be back, by the way. Thoroughly enjoyed last time. So, Social Security disability insurance is a Title II benefit. That means that the person who has become disabled has had work in the past. They have accrued enough credits by paying into their FICA taxes, their Medicare and Social Security, to start receiving the disability insurance benefits. That's for the SSDI. Do you want me to cover the other couple of Title II super brief?
Yeah, sure, that'd be great.
Okay. And the reason I do this is that other people are receiving Title II benefits, but maybe they haven't worked, but they are disabled. They were what they used to call disabled adult child, but we got used to that. So Social Security decided, no, we're going to switch that around to childhood disability benefits. And what that is those are benefits that someone who was deemed disabled before the age of 22 and their parent, or sometimes in rare cases, a grandparent, is receiving Social Security, either retirement benefits or disability benefits. And so the childhood disability benefits, they're able to receive a portion of that as well. And then, of course, there's survivor benefits, the disabled widower, widower's benefits.
Okay, great. So yes, you may be receiving Social Security disability, and that benefit may not be associated with your Social Security number if you are receiving it from either somebody that had a caregiving responsibility for you, either as a child or an adult, depending on your specifics of your situation. And so yeah, it doesn't necessarily have to be part of your Social Security record. Fabulous. So Kris, is there an actual amount that somebody should expect to receive when they're receiving Social Security disability insurance?
Unlike SSI, the SSDI, the disability insurance, it depends on how much you have accrued in your credits. So some people receive, maybe $1,000 a month because the jobs that they performed weren't paying that high. Some people receive $3,000 a month because they had very high paying jobs prior to their disabling condition taking effect. It all depends on what has been put into that magical account.
And that magical account would be your Social Security record. And
Correct, correct.
that you earn those credits you earn as many as 4 credits each year, and those credits accrue. And basically what happens is, whether it be disability or retirement benefits, your amount is associated with how much you've paid into the system. Great.
A
So
quick question.
go ahead.
I've been asked, I know the answer, but been asked several times, can you accrue more than 4 credits a year?
No, you can't.
Oh,
But what you can do is earn more money and put more money into the system. So
that's right.
that's basically how you accrue your credits. So it's not, I always say it's kind of like, think of it as like four seasons, but there's no time limit. If you're earning quite a bit of money, several $1,000s a month, you could earn four Social Security credits in 6 months. Um,
Mhm.
because basically it's once you hit a certain amount, you get a credit. Great. So can you tell us a little about social trial work months, and what a trial work month is? What does that mean?
Uh, Trial work month. Those are months where, well, just like it says, you're trying out work. During these trial work period months, you can receive your earnings and you can receive your benefits without penalty or being worried about that overpayment. The nice thing about trial work months is you have 9 of them. They do not have to be consecutive, but the threshold for the trial work period months is the same whether you're blind or disabled, not blind. And for 2025, that threshold is $1,160. So if you have a job where you're only earning $1,100 a month, you will not trigger a trial work period month. If you have a job where you are earning $1,200 a month, you will trigger a trial work period month. Additionally, with the fact that they don't have to be consecutive, meaning it stops and starts with the work that you have and the money you're earning, there is this wonderful rolling period of eligibility of 60 months. So if you do not use all trial work period months within a rolling 60-month period, 5 years, the oldest trial work period drops off the end, and then it is available to you to use in the future. There are some people who have very seasonal work that maybe once a year they would earn over the trial work period month threshold, where they could extend the trial work period months over those 5 years. It's rare, and but it does happen.
So the example that we like to give when we talk about that is, we say somebody that maybe um, helps out during the busy holiday season, and they might work November and December
Right.
every
Like they're
year.
ringing the bells.
Right.
Mhm.
Mm-hmm. Yep. Yep. And maybe if it's ringing the bell and they're ringing the bell from Thanksgiving to Christmas, that's just a month. So, um, they certainly would not use necessarily their trial work months in that short period of time. So they would gain those trial work months back. Great. Thank you for clarifying about trial work months. I think that sometimes people who are blind think that we get a special type of trial work month, and that's not the case. So that's important to remember.
I
Can
have
you,
a number of, oops, go ahead, go ahead.
I was just going to say, can we discuss the cessation and grace months?
Sure. So a lot of times when people have started work and they've got a very stable job, it's something that they're enjoying and there is a good pay. So you've gone through your 9 months. Then there are 3 more months where you can receive benefits and your earnings without without penalty. And those 3 months are the cessation month and the 2 grace period months. So it ends up that there's a total of 12 months that you can receive all of your earnings and your benefits without penalty. The cessation month is where they're saying, oh, look, you know, you're doing really great. We're getting ready to look at stopping your benefits, but you still have 2 grace period months after that. And like the trial work period months, those are not, they don't have to be consecutive. The other thing is that the trial work period months and the cessation months and the grace period months are only used once during a claim period. So if you've gone through those months, they're knocked off, they're done.
So, can you tell us about substantial gainful activity?
This is the one that everybody loves to hear about, the substantial gainful activity. Also is where people get confused between trial work period threshold and
Mm-hmm.
substantial gainful activity threshold. For people who meet the definition of Social Security Administration statutory blindness, otherwise known legal blindness, the substantial gainful activity is $2,700 a month starting in January of 2025. That means that you can earn just up to $7,000. Wouldn't that be nice? $2,700 a month and still receive your benefits without penalty. If you go above that, then your benefits are going to be suspended if you're in the extended period of eligibility phase, or if you're outside of that phase and you have used all of your cessation and grace period months, they will be scheduled for termination.
However, you do have the ability, now that's 2,700 that you
100.
spoke about. That amount is your gross income, not what you take home. So that I
That is
think is
correct.
also an area where people can get confused, and that amount is gross as long as you are an employee. If you are self-employed, it is a separate set of regulations that come into play, and we could do a whole webinar on that, but we're not.
Oh my goodness.
Um, so we are focusing specifically on individuals who are not self-employed, who are receive a W-2 and know their net and their gross earnings. But there are ways to have Social Security, earn above the 2,700, but still keep your Social Security. So Social Security disability insurance. So let's talk about what are work incentives.
So the work incentives, the term work incentives, covers all of what we're talking about, the trial work, all of
I'm
that. But we
sorry, I
have
didn't mean work incentives. I meant impairment related work expenses. I am so sorry.
that's okay. It's been a long day for both of us.
You're keeping me on
The
track.
So the impairment related work expenses. Now, this is another difference between our two benefit programs that get people confused, and you really need to understand the difference here. With us from SSI, we were talking about blind work expenses and they were very
Mhm.
generous. Here, entitled to benefits, you are talking about impairment related work expenses. This means that the expense must relate back to your disability and allow you to work. And you can, so if you have an IRA subscription, if you are, when you're using your canes and buying your cane tips, if you're buying braille paper, you're making payments on assistive technology, anything that you pay for yourself that is not reimbursed by your employer or through health insurance can be, you can apply to have that counted as an impairment related work expense. The impairment related work expense will then bring your countable income down. So if you're maybe making $3,000 a month, but you have about $400 a month in various impairment related work expenses, whether it's attendant care, whatever it fits. That's going to bring your countable income below the SGA level, which means you are still then eligible for benefits. And remember, SSDI, CDBs, Title II benefits, it's all or nothing. There is no sliding scale.
Right. So some other cases of impairment related work expenses are things like caring for your guide dog, feeding your guide dog.
Yes.
Things like if you have high blood pressure, it's important to let Social Security know that you have high blood pressure because while that's not your blindness, it's an other medical condition and you wouldn't be able to work if you didn't have your medicine. So your copay that you pay for that. Um, if you have
Hearing aid.
mhm, hearing aid batteries, medication copays, doctor copays. So you might be working full time, earning money, receiving health care through your employer, but now you have copays. Maybe you have a $50 copay every time you go to the doctor, a $50 copay for at the beginning of the year, maybe you have a medication deductible that you have to reach, things like that. So these are all examples of impairment related work expenses that could reduce your countable income for Social Security purposes, but help you maintain your benefits. Let's talk a little about transportation because this gets a little tricky. Um,
But
with Social Security disability insurance, your transportation can't be that you just buy a ticket to take the local subway, can it?
no, it has to be specialized transportation. Think about it. If you're using public transportation to get to and from work, well, guess what? Your coworkers are using public transportation to get to and from work too, many times. So, you know, it it gets it gets a little crazy making because you're thinking, well, I have no choice, but if it's unless it is specialized outside of the norm. Now, if somebody is driving you to and from work and they are not able to work because they're doing that for you,
Hmm.
there is an impairment related work expense.
Correct. Yes. And that's even if it is a family member, but again, they have to not be working because they're transporting you.
Hmm.
So it is a little tricky. Benefits practitioners certainly can assist in helping you to document these things. That is what our training is in, how to help you document things. Um, how do you recommend people document their impairment related work expenses?
I have a worksheet that I give people. It's very simple. I just made it up on Word with tables. And so every month you write down the date, what did the expenses for it, how much you did, and then you want to keep that receipt so that you have an easy reference. Some people have gone so far as to put a number, so there's another column. Number one is the fact that I went to the doctor and this was my copay. Number two is the fact that I went to the pharmacist and picked up this medication. I got canes. This is number three. So you want to be organized. And
Mhm.
so you have this cover sheet that lists everything down, and then you want to submit your receipts at the same time. You can, staple them, put them in an envelope, staple them onto a piece of paper so that they're all lined out. If you're going to put them in an envelope, however it best works for you, but you need to have proof that you had these expenses.
That's correct. And Social Security does really has the say as to if those work incentives that you're attempting to use really apply in your situation. Um,
Mhm.
The other thing to keep in mind is how Social Security counts your earnings. So let's talk a little about that. Do they count it in the month that you receive the payment, or do they count
For
it in the month when you worked? So for example, if you're paid every week, you conceivably could be paid for the month prior. So you might be paid for, like, say, the 30th, 31st, 1st and 2nd of the month. And go ahead.
yeah, no, this is one of those kind of tricky things. It counts in the month that you did the work, not the month you received the payment or the received the earnings. So
That's
not only are
correct.
they counting all of your earnings pre-tax, they they count it for when did you do the work. Um,
And that,
additionally, what
go ahead.
mhm,
I think you're
I was
going
just
right down the road I was going to say. Go ahead.
so a lot of times we accrue paid time off, we accrued sick leave, vacation pay, whatever you want to call it. That money is not counted towards your SGA levels because you did not actually work when you were sitting in the hospital or sitting on the beach in Aruba. Those times you were not working, even if you did receive money. Therefore, that money is not counted as earnings. That's another reason why you need to put in your pay slips and point out when you use your PTO, when you use your sick leave.
Great, fabulous. So, basically, if you had a week, I know some organizations, agencies, maybe plants. We have a local bakery here. They close the basically from the middle of right after Christmas Day, Christmas. I think they're open Christmas morning, but then they don't open again until the middle of January. But they pay their employees that during that time, and they give them a bonus. That income would not count because you're not actually working for that pay. Additionally, everybody else is getting the bonus pay. So it is important that if you get bonus pay, that you outline that as well when you're reporting your earnings to Social Security. Um,
That brings up a really good topic of when is bonus pay or merit pay counted and when is it not? Do you want to take that on? Because I've had some people who said, oh, I have to return my bonus because Social Security is saying that I'm now over SGA and I've lost my benefits.
yeah. So basically, what you want to do is document to Social Security that this benefit was received by all employees, or your department, whatever it might be. Your employer can give you a letter stating that. Also look to see how it's documented on your pay stub. Some employers do break it out separately. Sometimes they issue a separate check. So you want to identify that as well when you're reporting your earnings to Social Security. So let's talk about the extended period of eligibility.
The extended period of eligibility. This is a really interesting time frame. It's 36 months, so 3 years, and it only happens after all of your trial work period months are used. So, and once it starts, it does not stop. So your trial work periods months stopped and started as you stopped and started your income, levels of income. The extended period of eligibility does not stop once it starts, it's just counts down. During this period, if you have income over the SGA level and you've used your 3 months of cessation and grace period months, if your income remains over SGA level and you don't have enough in expenses to bring it down, your benefits are suspended. You're not eligible for those benefits. If something happens during that 36 months and your employment stops or you get cut in pay, your pay reduces, whatever reason, you've took half a month off and that brings your income below the SGA, then you are eligible for benefits that month. It really is the light switch on or off. It can fluctuate as your income fluctuates, but you don't have to reapply for your benefits to start up again during this extended period of eligibility. You can just let Social Security know, hey, when you report, hey, I'm below SGA levels. And remember, benefits are paid the month after you're eligible for them. So if your income went down in May and you reported that in May, the May's check would come in June.
Right. Yep. Great. So not to make things any more confusing here, can you describe what expedited reinstatement is? Let's say somebody has been working successfully and they are totally off of benefits. They finished their cessation and grace month 3 years ago, and all of a sudden the company says, well, sorry, we're closing. And what do you do?
So, because expedited reinstatement, that is another safety net that is available to people who are receiving Title II benefits. If your job goes away within 5 years of your termination date because your disability changed and you're no longer able to work, or as Lori was saying, the company shuts down and says, sorry, Charlie, you can go back to Social Security and say, hey, I really would like to get my benefits back because I am no longer working. And you can put in an expedited reinstatement. They will look at your past record. They'll run it back through. And as long as there's been no changes in your disability, within 6 months, you should have your benefits back. Additionally, there are 6 months of what we call provisional benefits that you are eligible for at the rate of your old claim plus any cost of living adjustments that might have occurred. During those 6 months, you're eligible for those provisional benefits. They can start up during that period of time. You want to make sure that your case is getting where it goes, because at the end of the 6 months, your provisional benefits stop.
Right.
And you want to make sure that your case has been determined. But even if for some reason they say that you're no longer disabled, those provisional benefits will not result in an overpayment issue.
Correct.
So
A-
considering
addition-
our audience. Hmm?
I was just going to say, additionally, when you go and reapply and do an expedited reinstatement, it is important to bring your tax returns for the years that you were working.
Yes.
Even that the IRS and Social Security are two federal agencies, they don't really communicate very well together. So if they were to wait for your IRS data to transfer into their system, you'd be waiting a couple of years sometimes in some offices. So bring your tax returns, your last pay stub, documentation of maybe if you were paid out accrued time that you had, so you didn't actually work those hours, but things like that. Bring all that documentation with you when you go to Social Security if you do an expedited reinstatement. I'm
The nice
just
thing is it does take less time theoretically than putting in a whole new application.
correct. And a new application would mean that you would have a 5-month waiting period. And that
Mhm.
would not happen with expedited reinstatement. But it would be, at the lower rate plus any cost of living adjustments, as opposed to a brand new application, which would mean that they would really take all of that additional earnings and make sure they were in the system before they reinstate you. Um, so, uh, in the interest of time, Kris, I
Mhm.
don't know that I'm going to go over our two little examples. I think what I'll do is I will send them out to people who have registered for the webinar. But let's talk a little about Medicare, because Medicare is not a cash benefit, but it is associated with Title II eligibility. So let's talk about what happens when you begin to work and you're on Medicare. So what would occur with your health insurance?
The Medicare, you know how you had that 24-month waiting period when you first were deemed eligible for benefits. It kind of works out in the end because there is the extended Medicare coverage that happens afterwards. So you can start working and you will still have Medicare coverage. Your Part A is already covered. You will have to make the Part B premium payments. And if you're not receiving benefits, they would be taken directly out of benefits, you will have to pay those Part B premiums. The easiest thing to do is to go to Medicare.gov to set everything up that way. But you can have this Medicare coverage for up to 83 months. You have, uh, I hope you can still hear me. I just got
Yep.
a thing that my microphone's changed. Anyway, Medicare benefits. So you can have them for up to 83 months after your cash benefits have terminated.
And uh, so who would pay the premium for that?
That would be, you would then be responsible for paying the Part B premium, Part D premiums for your thing. Unless there are some healthcare coverage, you want to talk to your benefits person with the company because the employer healthcare coverage can kick in. And you can also, if you have credible health care coverage, you can opt out of paying the Part B premium. You wouldn't have, which means you wouldn't have that coverage. You'd be relying solely on the health care coverage from your employer, but you would still have Part A.
Um, so I want to encourage people, if you haven't already typed your questions in, please do so now, and Katie will read us some of our questions.
Lori,
Yep, go ahead.
I wanted to ask, this is Richard. I wanted to ask you and Kris one question, and there are a question or two or three in the chat. For folks who, outside of this webinar and the information that they will get, what are some good places people can bookmark, whether it's Social Security or other entities that they can keep up to date with the changes on this topic?
I would say this,
SSA.gov.
yeah,
Mhm.
SSA.gov, the Social Security Red Book for whatever year you're in. Um,
Also, Medicare, the
yeah,
Medicare website.
yep.
Great.
Both of those are really the best places to go because you're not getting some sort of disability oriented organization that's shelling out the information they want to give you. And really, if you have connections with your vocational rehabilitation provider, you can certainly request benefits counseling from an approved, not approved, I shouldn't say that, we're not approved, we're certified. We're a certified work incentive practitioner. So.
Now, the other thing with the Medicare, the last thing I want to say on that is there are Medicare savings plans
Mhm.
that can help you pay the Part B premiums if you fall within certain guidelines. And those, we could do another webinar just on
Yes.
Medicare and Medicaid. It's not necessarily the easiest thing to understand, but there's hope because talking with Lori, myself, or somebody who is certified can help you out with that.
You know, and you additionally, you do need to think of your other benefits, your housing subsidies that you may have, whether that be through a Medicaid waiver or a Section 8 or similar type of voucher, you know, as
Mhm.
well as your supplemental nutrition assistance program. And, you know, there are some state variations for all of these other programs, but I do this work outside of APH nationally. Kris works
Same.
primarily, oh, okay, I don't know if you still only did Washington. So, you know, there are people out there that can help. It's important to get accurate information, really, is what I want to say. Don't rely on, you know, your best friend who is also blind, because they may not give you the right information.
You want to go to
But
questions?
Sure.
Sounds good.
All right, so first question is asking about, I think the amount of the SSDI, asking if it's based on your highest grossing years of work to receive it.
So the amount of SSDI, they'd have this wonderful calculation that they go through, but they look at your earnings and they calculate it much as they would your retirement benefit. So
Okay,
yes, we're looking at highest gross.
all right. Next, if you earn more than $2,700 a month, can you divert any of that into an ABLE account to get below the threshold and not be penalized?
No.
Okay.
Just like with
No,
SSI.
anything that you are paid, and that is a very good question, because also if you're paid under 2,700, but your employer contributes to an ABLE account, those earnings are also counted as earnings to you.
Mhm.
So yeah, we get that question a lot. It's a really good one. But so say you can't say to your employer, oh, can you pay me 2,500 and then put 200 a month in my ABLE account? It doesn't work. Social Security is going to see it because those earnings, that 200 is still money that you earned.
Earnings first, resources second.
Right. And there are no resource limits for Social Security disability, meaning you could have money in an ABLE account, you can have earnings in a retirement account, and it's not going to affect your Social Security disability insurance. That's, you know, kind of opposite of what happens with the Supplemental Security Income benefit.
Correct.
All right, what if you are working part-time and don't go over SGA? Are you still able to receive SSDI without being at risk of having it removed?
As long.
Go ahead. There's more to this.
There is more to that?
Yeah. Is there a time frame for how long you can collect SSDI while working?
Okay, shall I take this?
Sure, go ahead.
Okay, so no, if you are working part-time and you are under the SGA level, you will still be eligible for your SSDI. However, if you are earning over $1,160 as of 2025, then you will be using your trial work period months, and you will be going into the extended period of eligibility phase, because you will be earning, but you won't be docked you won't be docked your SSDI because your countable income is below the threshold level.
Right. And your work incentives, your work impairment related work incentives do not kick in until after you hit the substantial gainful activity level. So
Right.
that also is important to remember, but remember that earnings that employers who may be contributing 3% of your salary to an IRA, or whatever your 403b, 401k, that's also earnings again. So it's important to remember that.
Gross earnings.
All right. Are there any limits? One moment, my chat just moved. Are there any limits for end of year bonuses from employers?
As long as it's earmarked as a bonus, I like to tell my people to get a letter verifying that it is a bonus. If they can have that bonus issued in a separate check, sometimes employers will do that. I just thought of this because I did have this happen. An employer gave an employee a gift card, but then taxed it. So that became countable income, and that was a $500 gift card. So yeah, that if it's, anything that your employer reports as earnings, it's important to remember that that would be counted towards your income.
All right. Next question. Do all state voc rehab offices have certified benefits experts like you?
They should all have access to them. The employment centers, all the federally and state supported employment centers, the one-stops, are all required now to have work incentive practitioners on staff. That being said, because blindness is a little unique, specifically with the Social Security Disability Insurance Program, as well as the SSI program, I like to direct people who are blind to work incentive practitioners who actually know the benefits. There are several of us. We are small and growing. I know at least 8 of us across the country who are certified through Cornell, and are actually doing this work.
Okay, next question. Can Uber and Lyft be used as a work incentive for transportation?
That's a little hard.
I would apply it. So
Right.
when with work incentive, I'm sorry, impairment related work expenses, you are applying for these expenses to be accepted. And with Uber and Lyft, I have one customer who we are trying to get it added as an impairment related work expense, because she has to go across at late at night. Her job keeps her there until like 11 o'clock at night, and she does not feel safe to make multiple transitions in the buses, and she has PTSD that adds to it. So that's why we're trying to get it accepted as an impairment related work expense.
Yeah.
I don't know. What do you think?
I agree with you. Having just done a webinar where this very issue came up, it's tough But again, working with a benefits practitioner, or a rehabilitation counselor who can help you to document these types of things. You know, it may not be because of your blindness that you need this. If you have respiratory issues that are significant and, you know, you couldn't be outside in the cold, breathing cold air for long periods of time at a bus stop, you know, something like that, you know, you have to look at the big picture. So it's not a yes or no right off the bat. So it is possible. It also may depend on how good the Social Security employee who's approving your work and your impairment related work expenses is feeling that day. So that's the other side of the coin. It could
That's
happen
true.
to somebody in one office, and you know, somebody in an office 15 miles away could be told just the opposite. You know, so yeah, it's not a cut and dry answer.
Along those lines, I have a question asking if the employer pays for someone to drive back and forth to work, is that counted toward earnings?
Ooh. Like driving the person to and from the job, I would,
Who's getting the money?
yeah, I would say a couple of things. Who's getting the money? Is it only going to the driver? Because that's what I would say would need to be done. You don't want your client to have any contact with that. You don't want the client to pay the money and then the employer to reimburse them. That's not, no, that doesn't work. That being said, though, if an employer is going to pay for a driver for a blind employee, and not do it for other employees, that also raises a whole other issue and really could get tricky. Anything to add, Kris? Disagree with me?
I think you gotta, I would want to know more. Like, my biggest thing is I wouldn't want the employee who is blind to have anything to do with the money
No,
for the driver.
no, no, for a variety of reasons.
Yeah.
Not just benefit wise.
It's got a whole big can of worms there.
Yeah.
All right, what about paying for healthcare? If the employer pays for part of healthcare at work, does that count as earnings?
If the employer pays it for everybody else, no, but you can't pay the health care specifically for a person with a disability. You know,
I-
I think what they may be getting at is, you know, how you have your gross salary and then you have a listing of your value as an employee. So like when your employer pays money towards the larger percentage towards healthcare, that does not count as earnings. But if you're only doing that for a disabled employee, again, I don't know, that's well beyond my knowledge.
yeah, yeah, when I immediately thought of somebody who was getting their paycheck, and out of that paycheck are the different deductions. You know, you're
Mhm.
paying so much for healthcare and it's deducted out of the paycheck. So, but Social Security is going to look at the gross income before those deductions are made.
Right. Yeah, the employee portion that is paid in for healthcare insurance, that is not considered a deduction at all. And do we have another
Oh,
question, Katie?
I think I got them all.
Okay, we have a few more minutes. So Kris, my favorite topic and your favorite topic. Let's talk about how to succeed financially once you might still be on benefits, but what are some ways to save money specifically if you're blind or low vision
Uh,
or disabled?
well, my favorite way, my absolute favorite way is to get an Achieving a Better Life Experience account or an ABLE account. Now, with SSDI, our Title II benefits, we know that resources are not counted for those benefits. They don't care. You could have $1 million in the bank, and if you qualify for SSDI benefits, you'll still get your benefits. However, when you're looking at your other benefits, such as housing, Medicare savings plans, SNAP benefits, they do count the resources. So you don't want to be penalized for working and trying to save while you're transitioning off of these other needs-based benefits. Best way to do that, an ABLE account. ABLE accounts are fantastic because you can put money into them and they're not counted as a resource for your federal-based income needs-based benefits such as housing, TANA, or not TANA, excuse me, housing, SNAP, and Medicaid, which helps with the Medicare savings plans. And
Great. And what is the amount
this
for, go ahead, I'm
for this
sorry.
year?
Yes.
No, I was just taking a breath because I had to think for a moment. Oh, it just changed. This year, the amount that you can put into your ABLE account or that Daddy Robux can put into the ABLE account for you is $19,000. If you are working, you can contribute an additional amount to your ABLE account on top of that, and it is equal to the federal poverty limit, which last year was 12,000 and change, and I forget what this year's level is because they just recently came out with those.
Yeah, and I actually, it also is kind of tiered. So if you earn below a certain amount, it's one level, and then if you earn above, I think it's $30,000, it's a higher amount in addition to that 19,000 that can be contributed.
Right.
But
The
you can, for more information on that and to compare the ABLE programs, you can go to the ABLE National Resource Center. That's ABLE NRC. That's N as in Nancy, R as in red, C as in cat.org, and find out your state's program or another state's program that allows for outside contributions.
One of the things I liked is when I first got my ABLE account, and they've only been around for, I think, since 2014, if I remember correctly. Uh, Obama signed them into law, is that I didn't care for my state's ABLE account. They were brand new. They were still working out the kinks at that time. So I went on to ABLE National Resource Center, ablenrc.org, and I looked at the other states. What was their account like? Did they allow for people who did not live in that state to open an ABLE account? So when I opened my ABLE account, I opened it up in the state of Virginia. Additionally, the ABLE Now app on the iPhone is incredibly easy to work with, and yay, 100% accessible with VoiceOver.
The other thing to remember is that sometimes within your state, your earnings are taxed less. So if you say your first $2,000 of earnings may not be taxed if you're working and you're contributing to an ABLE account. And that typically, but not always, relates back to the state of where the guidelines are going to be set by the state that houses that program. When I lived in New York, did not open an account in New York because I knew I was going to be moving. I just didn't know when and where. So I waited. Um, and I live now in Virginia, and my Able account is also through Virginia. But it 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 is a nice program, and it gives you the ability to have both like a checking account, a savings account, or you can make it more of a long-term savings, kind of like an IRA type of account.
So it has the investment option
Yes.
after you have that first $2,000 in there. And that's nice because we all like to have investments and a little bit of a surety for when we're no longer able to work. And you never know what's going to happen. You could find yourself in a situation where you really wanted to, or you needed to access those needs-based benefits. And with an Able account, you do not have to drain everything before you are able to access those benefits.
And two little things I'd like to cover in our short time is the age onset requirement for an Able account, and also what can the money that you withdraw from an Able account be used for?
So originally, the age onset is that you had to be deemed disabled before the age of 26. Next year, in January, that age is being raised to 46. So people who have become disabled later in life have an opportunity to start their Able account. And what was the other question? I'm sorry, my
What
brain just
No, that's okay. What can the money from an Able account be
ah
used to pay for when you withdraw it?
It needs to be used for qualified disability expenses. Well, what are qualified disability expenses? They're very generous. They're things such as clothing, food, rent, utilities, medical bills, assistive technology. You can take yourself out to them